Hi there. Thank you so much for joining me today. I'm Dr. Tahir from Family Pediatrics in Kenosha, Wisconsin. Today I'll be talking to you guys about a condition known as tongue tie. That's a condition with babies where their tongue is connected very tightly to the bottom of their mouth, so they can't move their tongue very well. And as you can imagine, that causes difficulty with feeding. A lot of times with breastfeeding, that can cause some intense pain and problems. Just recently, I had a mom who had a baby and she was having intense pain with feeding and was having a hard time breastfeeding her baby. And when I checked the baby out, I realized that this baby had a tongue tie going on, which was causing the difficulties. In fact, almost half of the babies with a tongue tie can have some difficulty feeding. So it's important to recognize that. And when you do, and if there's a problem, you want to fix the tongue tie. So I'll talk to you about that too. Here, I'll show you pictures of tongue tie. I simply Googled tongue tie and looked at the images. All right, you notice right over here, for example, when you're looking at the baby's tongue, there is a little connection between the bottom of the tongue and the bottom of the mouth. This connection sometimes go right to the very tip, and that can cause a lot of problems. Here the baby has a connection, and when she tries to stick out her tongue, she can't stick out the tip very much, and so it looks heart-shaped, you see? This one you can see pretty clearly also. This baby has a pretty severe tongue tie, and there's a connection between the very tip of the tongue to the bottom of the mouth, and this poor baby can't move her tongue anywhere. This one you can see also, this baby's crying and can't lift up her tongue because there is a little connection between the tongue and the bottom of the mouth. Here you can see quite clearly, again, a connection with the bottom. This one shows a picture of a normal tongue, which does not have a tongue tie. So this gives you an idea of what a tongue tie looks like. All right, so now the question is, what do you do when a baby has a tongue tie? Well, what you'll want to do is talk to your doctor to see if they can do a procedure where they cut and release the little connection at the bottom of the tongue. Not too many doctors do that. I do that in the office here. You want to make sure that the doctor that you choose uses pain control. I always recommend pain control whenever possible for any procedure possible. So at my office, I use a topical anesthetic, so it numbs up the skin, and also some medicine to prevent any bleeding. There's a procedure where I basically cut the connection that connects the tongue to the bottom of the mouth and releasing the tongue. It takes just a few minutes, and right away after that, we simply feed the baby, and usually you can notice a drastic difference right away, or the mom does anyway. So there you have it, guys, tongue tie. If you think that your baby has tongue tie, make sure you address it right away because it can lead to problems, and there is a fairly quick and relatively simple procedure that can be done to release the tongue. Thank you so much for joining me today, and I'll talk to you guys later.